I heard about SOLEA through my local Patterson rep. He had mentioned that there was this exciting new laser and he wanted me to give it a try. And so I did, and I liked it. And so I bit the bullet and got one. My name is Dr. Ravi Sandhu and the office I work at here is Clarkson Village Dental Clinic.
J'assistais à une formation sur le laser, une présentation par Patterson. Puis je suis tombée en amour avec ce laser-là. Dr. Valérie Roy, centre dentaire Mont-Saint-Hilaire.
Now, and we find about SOLEA, we got trained, and we say, oh my gosh, we need to get SOLEA. SOLEA has to be, the best technology what we can offer to our children. I'm Dr. Magdalena Herrera. I'm a pediatric dentist at For Kids Dentistry.
My grandfather was a dentist, my father was an orthodontist, my uncle's a dentist, so it's kind of in the blood, in the family. Hi, my name's Dr. Jessica Milne and I work at Edgewater Dental.
I've always liked technology. I'm a little bit geeky that way. I've got a lot of technology here in the office. When I saw the SOLEA laser, I just thought, okay, that's cool, I need to get one. Jay Patel from Calgary, Alberta at Outdoor Dental.
Le laser offre vraiment plusieurs types de traitements. Ça permet entre autres d'éviter les principaux désagréments aux patients, ce que les patients vont craindre le plus chez les dentistes, c'est-à-dire l'injection au niveau de l'anesthésie, le fait de rester engourdi, c'est vraiment désagréable pour eux, et la vibration aussi de la pièce à main pendant qu'on travaille dans leur bouche, donc le marteau-piqueur, comme plusieurs appellent.
The fact that it can do fillings without freezing is amazing. Patients love it, I love it. It makes appointments a little bit quicker, which is great for the patients and myself, obviously.
Hi, my name is Dr. Brad Campbell. I'm in Charlottetown, Prince Edward Island. I'm the owner of the TMJ and Sleep Therapy Center of Prince Edward Island. Many of my patients present with apnea, sleep-related issues, clenching, grinding, which has some jaw-related issues with it. And part of that link is being tongue-tied or even lip-tied. So it allows me to treat those patients to the nth degree.
This is an amazing thing to use on your crown and bridge cases. I am a CEREC dentist. I do a lot of my own inlays and onlays and crowns here in the office. Dr. Christopher Blair, Palermo Village Dental.
I will use the SOLEA if I need to trough some of the gum tissue so I can see the outline of the tooth better. So that's how SOLEA has helped me with CEREC.
La vitesse également de taille, quand on a vraiment pris nos repères, ça va très vite, c'est très efficace et on n'a pas besoin de se contraindre à utiliser des hémostatiques, des agents qui vont créer de l'hémostase, donc empêcher le saignement quand on fait certains types d'empreintes ou quand on veut faire autre type de traitement. Tout est fait avec le même appareil, donc c'est vraiment génial.
From my patient's perspective, again, the dental experience is now different. First when you tell them that you're going to do this filling without numbing them, they kind of look at you a little bit, sideways, a little bit skeptical. But I put the control in their hands. I say, listen, this is going to be new for you. If anything about the experience you don't like, you let me know, and I'm happy enough to switch and freeze you up if we have to. And we get started, and before you know it, we've finished the restoration. They jump up out of the chair and they're like, "That was amazing." That was, they'll give me like on a scale of 1 to 10, a 0 to 3 in terms of the sensations that they felt. They really appreciate that now they can go back to work, back to school, back to their daily routine.
The SOLEA laser has a great benefit for patients, especially patients that are a little bit more nervous or a little bit more anxious, especially patients that are needle phobic. There's no needles involved at all, right? We can do a filling without freezing at all. So for those patients, they say it's changed their lives. They'd be really afraid to come to the dentist. They knew they have a cavity. They had sensitivity and they knew something was wrong. They just wouldn't come in. Now when they get the laser, they come in and they say, oh, now I'm not going to wait. I'm just going to come in. They're no longer afraid. The anxiety level goes way down, and it just changes their lives, they say.
We saw a patient the other day. We performed 6 fillings, 6 restored teeth in half an hour, no freezing. Patients were very happy. Mom was thrilled, patient was happy to come back, and this is what we're looking for.
All the patients are really surprised and they're loving it. They've all said to me, where has this technology been? And finally it's here, something to replace the drill. So they're all very, very happy and impressed.
It's faster. I can feel my face. I get really nervous when I lie in the chair, but that was a really, really great experience. I would do that again. If I needed to, for sure, I would definitely do the laser again.
With the SOLEA, not only we use for hard tissues, but we use it also for soft tissue. So we can help newborns. We can help patients who has tongue tie, lip tie. We see newborns, as early as 4 days old, and we assess the patient. And if we determine that the patient has a tongue tie or lip tie, we explain to the parents, and we decide, oh, let's perform, the release. Let's do the surgery, and we use SOLEA for the surgery, and has been amazing.
J'ai beaucoup d'enfants dans ma pratique, puis de les engourdir, de rester engourdi, surtout pour un enfant, c'est très difficile. Même si on a des produits qui vont inhiber l'anesthésie plus rapidement, il y a plus de risques de morsure, il y a plus de risques de blessures après. Donc avec ça, c'est merveilleux. Même les enfants sont super heureux, ils pensent qu'on fait du Star Wars dans leur bouche avec des lasers. Fait que c'est vraiment merveilleux pour eux, là.
Yeah, I had 7 fillings one day. It was really good. It didn't hurt, but it was kind of cold at the beginning, but it didn't hurt.
It's worth it, and I had several in one day, and I left feeling great.
There is a learning curve. Anyone who's going to get involved in this technology is going to have to be patient with it. It does take a little bit of time to get to that point where you are able to deliver the claims that the company has made.
I felt like I picked up on the laser very quickly, and my training was exceptional.
The initial first few months, there was a learning curve, but it wasn't difficult. It just took some practice, and yeah, it came pretty naturally. Again, I'm pretty used to technology. I'm used to trying new things, so I just kind of gave it 100%, and it came pretty naturally after that.
SOLEA has been great. I went to California to do my training with Dr. Rohde. He was excellent. There was a lot of hands-on there, plus a lot of good tips and tricks that he gave. And also the SOLEA company came and did in-house, in-staff training where they got to watch me work on live patients and give me right there on the spot feedback, which I find was very, very helpful.
This laser has positioned me in a different place compared to my colleagues. No one else in the area has one.
Because, like any industry, there are a lot of dentists out there. There are a lot of everything out there. So how can you stand out? I mean, I think the SOLEA helps you do that.
Another reason why I wanted to incorporate the laser in my practice is because I wanted to find that niche, that little thing that makes me special and unique, and sort of be kind of one of the forerunners in embracing this new technology.
And it opened up a lot of other procedures for me. I could do a lot more soft tissue procedures that I wasn't doing before. It was a neat piece of technology that I thought, okay, this is going to change things. This is the way dentistry is going anyway, so I might as well get in right at the start.
Mes attentes personnelles avec le SOLEA, oui, sont vraiment excellentes. Ça fait pas très longtemps que je travaille avec, puis je m'en passerai déjà pas.
I can't imagine not having a lot of these technologies now that I utilize on a daily basis to make the practice of dentistry much more fun for me. We're always looking to grow here, so and one of the things that my patients have come to expect is that I'm always going to be adding new technologies. I'm always going to be adding something different into the practice. They go out there, they talk about it to their friends and families, and that's how my practice continues to thrive today.
Possibilities and what we're going to be able to do with the laser, it's going to always evolve, and there are going to be more and more things that we'll be able to do. So as I grow in the practice, I think the laser is going to grow with me.
And I really fully believe that we're just at the beginning stages of what this laser is going to do in the future. So I'm pretty excited about that too.
I hate going to the dentist, but you know what, that wasn't too bad, that was good, I like that. Those kind of comments you hear, and that's nice, because then it makes you feel like, okay, I feel good about what I did, I feel good about the investment, I feel good about what I do.
I think the future is really bright with SOLEA. I think this is just beginning. I think we can do so many more things with SOLEA in the future.